Hi, this is Lloyd Hay, and I'm a scoliosis surgeon in Raleigh, North Carolina at the Hay Clinic. And one of the most important things about scoliosis is understanding the natural history of the disease. So this is a picture of Stu Weinstein and Ignacio Ponseti'sl, who's passed away both from University of Iowa. And they did this incredible study years ago, looking at the natural history of scoliosis among a group of about 102 patients who were initially evaluated in 1932 and 1948, and then followed up in 1968, and most recently in the late 70s before publication of this in the 80s. And one of the things they point out at the very beginning of their paper is that is for the optimum treatment of patients with idiopathic scoliosis, the surgeon or the caregiver of any kind should have an extensive understanding of the natural history of the disease. And at that point, there had been very few studies with long-term follow-up. And originally, it was thought that once skeletal maturity was reached, there would be no tendency for progression of the curve. However, in their two previous reports, they had shown that there was some evidence of progression. And this is super important for our pediatric patients and our adult patients to truly understand this and to see how they can affect change to optimize their outcome. Because let's face it, we can take our health for granted. Like this whole COVID outbreak, my goodness, overnight our health is threatened, not just here and around the world. We can also take our core for granted, which is the core of our body, our spine. Those 17 plus segments that hold our head above our pelvis and keep us off the ground so we don't fall over like the Leaning Tower of Pisa. But that structure needs attention. That structure needs to be taken care of, and an ounce of prevention definitely is worth a pound of cure. So let's just talk about what Dr. Weinstein and Ponseti'sl found in this important study. The big thing that they pointed out was that curves that were under 30 degrees were much less likely to progress. 30 to 50 degrees were progressing more, and then curves over 50 tended to progress the most. And so this we actually can look at by looking at their graphs in more detail. So this is a thoracic curve. Here we see a curve that was over 50 degrees right here, and it does progress during this patient's lifetime. You can see how it really buckles. So here I have the graph, the original graph from Weinstein and Ponseti'sl, and I've just overlaid the green zone here, which is for curves less than 30. Look at how nice those curves stay consistent and don't progress over time. And then the curves 30 to 40, we see one stayed constant, but another one did tend to progress. And then look at these curves above. This curve that's 42, wow, that one really progressed over the next 40 years. And these other curves also tended to progress. So, boy, wouldn't it be great to diagnose the curve down here and keep it down here, either using Schroth plus bracing, so that we can prevent you from ending up in these other curved ones. So that's the thoracic curve, which is a fairly common one. The next way to look at this is by placing the curve at skeletal maturity here versus at final follow-up. So if there was no progression, basically all of them should fall in this line going right up at 45 degrees, and they put plus and minus 5 degrees. So you can see down here in that green zone, less than 30, that all three of those stayed in the green zone. Whereas when we get into this yellow zone, the 30 to 40 degree range, you can see we have a couple that didn't progress, but then we have a couple here that did in this thoracic curve. And then when we get up into that 40 to 50 degree range, well, look, there's really no data really to speak of in that range. But once it gets up into the 50s, we see that they all, very much most of them seem to progress. So if we look at it for lumbar curves, which many of our patients have, once again, actually this is a combined curve. This is actually a thoracic curve combined with a lumbar structural curve. And once again, we see the curves that are in the green zone under 30 tend not to progress or progress very little. And then these curves that in the lumbar area on those same ones, once again, don't progress or progress very little. Once we start getting into that yellow zone, 30 to 40 degrees, then the lifelong progression, like there's one case here, and there's another case, here's a case here at the upper end, and here, all of these, look at this one, 37 degrees, progressed to 72 degrees. And this thoracic double curve progressed here all the way up into the 60s. So we want to be down here. We don't want to be up here where surgery is going to be more indicated. And so here's just an example of a lumbar curve, 24 degrees, some rotation here. But then look at this, 35 years later, we're at 45 degrees with a big trunk shift and a spondylolisthesis, this patient could be developing leg symptoms as well with that progression over time. Here's another example, 35 degrees, lumbar, thoracolumbar curve, very common, but we see that there's quite a bit of rotation in here, and that can be measured using the META or using our scoliometer, which we're going to talk about more in a future YouTube and podcasts. But look at this, it progressed from 35 to 62, just 35 years later, really buckling, which even looks painful in that x-ray. And then so for the lumbar curves, here once again we see, look at this good news in the green zone, that these curves under 30 really don't seem to progress, whereas those curves in the 30 to 40 degree range, this one progressed a little bit, but look at this, 1, 2, 3, 4. All 4 of these are going up at about a 45 degree angle. All of these progress. So out of the yellow zone, 4 out of 5 progressed, or 80%, into that 70 to 80 degree range. And then we have these other thoracic curves above. And then if we look at this once again using the at skeletal maturity versus at final follow-up, optimally we'd love to see everything along that straight line, but clearly in this case we don't. We see a few stragglers out here that did progress, but here in that yellow zone, in the 30 to 40 degree zone, we see 3 that stayed within a reasonable range, but then we see this cluster of 5 that are really have progressed a lot during their lifetime. And then once again, once we get into that red zone above 40, we see there's several of these that are that have progressed, and 3 that stayed within that range. So these curves tend to progress, especially in the yellow and the red zone, 30 to 40 or 40 and above. And so all of this is laid out in the paper with the various measurements here, and just show the length of follow-up and the actual amount of progression. And what we see is really as the curves get larger, that we will see larger curve progressions, but the key thing is whether we're under 30 or above. This is just another way to graphically represent it, just to make it more visual. So let's just take the thoracolumbar curves, which there weren't many, but here we're looking at a group of teenagers. Here one has a curve of 35, one has got a curve of 50, one has a curve of almost 60, another one's up here almost at 85. And then if we play this out over time, what we'll see is that there's a small curve here that was picked up in the 20s that progressed a little bit, but once again, this one curve that's in that 30 to 40 degree range really progressed quite a bit, and some of these other curves above obviously progressed as well. So having a curve under 40 degrees clearly is not predictive of being out of the woods, because the one curve here that was in the 30 to 40 range progressed dramatically. So we can't just use the under 40 rule and pat them on the head and say everything's going to be fine. So what happened to the n equals 1 a TL curve 30 to 40 degrees? It progressed into the mid 60s, and that's from 34 to 65 degrees. So when we think about the quote that's used, for example, in the up-to-date, in the adolescent chapter, it talks about the goal of treatment is a curve with a Cobb angle under 40 degrees at skeletal maturity. Natural history studies indicate that curves under 40 do not progress after skeletal maturity. And actually one of the papers they reference is actually this paper. But clearly it's not saying that. And so we're going to work with up-to-date with their editors and the writers to get that corrected, because this really should be under 30 degrees. So that's not true. And so here, once again, even when Weinstein and Ponseti'sl wrote this paper, they clearly were thinking about the dividing point being the 30 degree mark, not the 40 degree mark, which we saw in the raw data makes sense as we see the curve progression numbers here. So it really, we do need to really watch that group, and maybe using conservative therapy, keep our curves under that 30 degree mark. And so in conclusion, we don't have many natural history studies to look at. This is one of them. We'll look at a couple others. There's one out of Italy we'll probably look at next. But as a parent, as a patient, as a caregiver, as a PA, as a physical therapist, as a potential referring provider, this really makes the case for why early detection with screening and early intervention with things like Schroth therapy and more modern bracing with 3D CAD-CAM design like the Rigo Cheneau brace can affect the curve early and potentially keep us out of that vicious cycle that we're going to talk more about in the future, in the biomechanics of that vicious cycle of ongoing degeneration and collapse over time. So as I celebrate my 25th year in practice, actually later this week, I've seen thousands of kids and thousands of adolescents and also thousands of adults. And I've seen that suffering in those older groups where it's not just a statistic. So boy, it should just be so great if we could just work together to try to prevent that suffering with early detection, early treatment, and even use papers like this to motivate the kids to wear their braces, do their Schroth, and also to motivate primary care doctors to be aggressive about asking about scoliosis and screening for it using scoliometers and scoliometer apps, which we'll talk about likely in our next YouTube and podcast. Thank you so much for your attention. We look forward to working with you to take better care of our core together.